Hey everyone, this is Derrick Broze of the Conscious Resistance Network, and today I'm going to talk with you about COVID-19. We're going to talk about Texas, we're going to talk about Houston, and we're going to ask if the recent spike in cases, not deaths, because if you've been paying attention, the deaths aren't climbing. We're being told the cases are climbing, the hospitalizations are climbing, which are important. We don't want to overwhelm the healthcare system. But we're going to ask if these reported jump in cases that are taking place in Texas and elsewhere, are these real? Are they fake news? Is there something more to the story than we haven't been told? That's what we're going to get to the bottom of today. First, though, I want to remind you guys to bookmark theconsciousresistance.com, which is my website, my home for all of my content, articles, videos, documentaries, books, interviews, podcasts, everything you want to find can be found here on theconsciousresistance.com, including t-shirts if you want to rock Conscious Resistance shirts and support us. If you want to follow us on Minds, Hive, join our Discord channel, follow us on Remind. If you want to follow us on Float, we're also on BitChute. And if you want to support, you can do so on patreon.com/Derrick Broze. Finally, you can support by getting yourself some Kratom right here through My Brave Botanicals. So if you have been paying any attention in Houston, you might have noticed that we are being told that we are on the brink of disaster, of apocalypse. A couple of weeks ago, they said all the hospital beds might be filled. And as you can see right here, it says less than 1,000 ICU beds are available in the entire state of Texas, they're claiming. So we're even at the point now where just this week they reported that a Houston company is seeking volunteers for a COVID-19 vaccine already. It's moving forward at a very rapid pace. Not to mention, we now have health officials telling people here in Texas, the Texas Division of Emergency Management, advising residents to wear masks at all times, even in their own homes. The situation is escalating rather quickly. And this is due to, as I said, the numbers we're being told are jumping up. They're climbing rapidly, and people need to do something about this. Well, a number of you have sent me some interesting information, articles, as well as videos. And after doing a little bit of a deep dive into it, I realized, you know what, this is an important piece of information I need to share with you guys. Some of you may have come across this article from Ron Paul just a few days ago. Is the Texas COVID spike fake news? And it's very brief, so we're just going to read through this briefly and then get to the details. On July 2nd, Texas Governor Greg Abbott issued an executive order mandating the wearing of face masks across the state. Whether indoors or outdoors, within 6 feet cannot be maintained between people. In the governor's decree, he cited a rise in COVID cases, a rise in test positivity, and a rise in hospitalizations. So, rise in cases, rise in testing positivity, and rise in hospitalizations. The move, according to Ron Paul, is not only a violation of civil liberties of all Texans. Abbott may have based his executive order on inaccurate information about a rise in COVID cases due to the Texas State Department of Health Services changing their definition of what constitutes a COVID case. Thanks goes to Colin County, which is here in Texas, Colin County Commissioner Court Judge Chris Hill, for blowing the whistle on what appears to be a move in mid-May to redefine what a COVID case to open the door to a massive increase, all to match the mainstream media line that a second wave was on the way. In the commissioner's court hearing for Colin County on May 18th, it was revealed that while previously the determination of a COVID case was, due to a positive test result, which again, I would argue the PCR tests themselves are also problematic, but let's just stick with people who have actually, been tested positive. Those are the people that we're going to go with. Should be considered a case. But the definition was suddenly changed to count probable cases as cases. At the same time, the threshold for determining probable was lowered to a ridiculous level. As Judge Hill said on the May 18th meeting, quote, if you have a subjective fever and you have a headache and you live in Colin County, you now meet the qualifications for a probable COVID-19 patient. It is remarkable how low the standard is now. Even worse, once a probable case was determined based on possibly unrelated subjective criteria, up to 15 people in possible contact with that probable case are also listed as probable cases, and probable cases were considered cases. So do you get that? The first person is found to be a probable case based on flimsy data or flimsy requirements, and then at the same time you have everybody that they've been in connection with or contact with through contact tracing would be considered a probable case as well. And repeat this across Texas. Is it any wonder why there are spiking cases? Also, Governor Abbott's claim that hospitals were being overrun by COVID patients were refuted by the Houston hospital directors themselves. And I covered this a week or two ago when I did What's Happening in Houston. So Ron Paul wrote that, and other people have been talking about it. And let's check this out. I came over here. Here is Colin County, Texas.gov. This is the official Colin County government website, so you can't claim this is fake news. We're under here under the Commissioner's Court agenda. And as you can see, they did indeed meet on May 18th at the Jack Hatchell Administrative Building on 2300 Bloomdale Road. May 18th, 2020, 1:30 p.m., Commissioner's Court. And I just searched through to find anything related to COVID. Let's do that. And we find a couple of things here. We find this. It says general discussion, presentations, COVID-19 update, administrative services. There's a presentation, which we're going to look at in just a second. COVID-19 testing. There's a few different memos that are going on. Even, let me see if I can just show this to you guys right now. I'm not even sure if you guys will see this. I literally just got an update. We're going to go ahead and open this up live while I'm recording this. I just got an update through my Telegram channel. So let's see right here. Excuse me. Sorry, guys. I'm doing this live while I'm recording this, and I just got this update. I want to make sure to see that you guys see this, what the information is being pumped out there while we're examining the cases. Here's this. We're seeing the worst of the worst. Houston nurse describes dire situation in ICU surge. I don't have the time to research who this woman is, if she's really a nurse, what the situation is. I do plan to go film some of the hospitals. And they've even been saying that it's getting bad like New York, and they might have to bring those 18-wheeler trucks where they're going to load up all the bodies in. And we'll see. If they claim that, I will go film them. So while this is going on, while there's news popping up like this, we've got, Ron Paul and people talking about Colin County, as I just showed you. And here, we're going to play just a few minutes. Here's the Colin County video meeting of the Commissioner's Court from May 18th, 2020. I'm just going to play you guys the first 5 minutes or so. So please check this out.
State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases.
So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. So at the end of this definition, there are 15 different options on how you could be classified as a probable case. Based on this diagram and what they report, there's a total of 17 cases now. One is still only confirmed because that was that original index case who then had all these contacts underneath in orange. And all the rest of them became probable, but they are still considered a case.
This has the potential to be a very significant event for us here in Texas and here in Colin County, as the state now has elected to adopt this new probable definition. If you have a subjective fever and you have a headache and you live in Colin County, you now meet the qualifications to be a probable COVID patient. It is remarkable how low the standard is now. Mm-hmm. If you have one of the major symptoms, you have a cough or you have shortness of breath, and you live in Colin County, then you can satisfy the definition for a probable COVID case. But I'm very concerned that we absolutely could see the numbers jump very rapidly in a way that actually is not indicative of what we're seeing here in the community in the public health department. State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases. Probable case definition was adopted by the Council of State and Territorial Epidemiologists back in early April 4th or 5th. They adopted this. They sent it to the CDC, and the CDC did take that recommendation and adopt it and send it out to the various states.
So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. Meaning if you use another testing method, not PCR, and if you have close contact with a confirmed or probable case, and if you did that lab work that was not a PCR, you could be considered a case with or without symptoms. They also updated the definition for deaths related to COVID-19. Previously, prior to this definition, it was only if you had a positive PCR result that you would be counted as someone who died related to COVID-19, now that lab testing is no longer required to be counted towards that. So if you do the FDA-approved testing, which right now is serology, looking for antibodies, IgG, IgM, you have to have the clinical criteria. And if you don't have that, and then you have the EpiLink, then you could still be counted as a case. So if we look at the yellow box here, that's the approved testing, right? If yellow, you have the test, and then you have any of the blue, you're a probable case. If you're yellow and you have any other close contact, which doesn't mean you're sick, you're a probable case. And then if you don't do any of that lab work, and then you get sick and you were a contact of a case, you are then counted as a probable case. You have to be a close contact of someone who's a confirmed case of COVID-19 or a probable case, or you came to a location where it's endemic. Right now, Texas has stated that they are considering the state as an endemic area. So that means if I just went and got serology testing done with no symptoms and I was positive, whether it's saying that recent infection or current infection, my new antibodies, or it's like I've had them for a while, I would be counted as a probable case. So basically, these three boxes, you can be yellow and blue without green to be counted as probable, yellow and green without the blue, and then blue and green without the yellow. But for the blue and green, if you had contact, that has to be within 14 days. So let's say activity dies down, slows down, and we're not considered endemic. Then we need that 14-day. But right now, that 14-day doesn't matter. Moving forward, it may, when activity slows down. So at the end of this definition, there are 15 different options on how you could be classified as a probable case. So that same scenario, a little bit more extended. Now, if we look at it with the new problem.
All right, I'm going to stop it there. I will include the video, the link to this video, which, by the way, this is it. All they did, as you can see, it was taken from band.video. I'm not sure who originally uploaded it. This is just a copy of it. But all they did was just copy and paste and cut out the pertinent sections of the Commissioner's Court, which I just showed you guys the link. And here's the presentation they were just showing, which, again, is on the Colin County tx.gov website. COVID-19 case definition. The Department of State Health Services distributed a new case definition for COVID-19 on May 11th. So think about this. The state of Texas Department of State Health Services does a new definition in mid-May, and then come June and July, where we are now, as these new methods start being put into place, all of a sudden there's a rise in cases. So the argument's being made that it's not an accurate count because they're changing it. So here was the current case definition. A confirmed case of COVID-19 equals a positive PCR lab result. And again, like I said, PCR tests are problematic on their own, but let's just assume that they work, and even those who are being found positive through that are legitimate. It's a big assumption for the moment, but let's just put that aside. So it says any contacts of the confirmed case, regardless of symptoms or any other lab, not PCR positive tests, were not counted as a case. Deaths equal positive PCR COVID-19 result was needed to count towards a COVID-19 related death. Remember, related. We've already discussed this for months, how various government bodies have been already counting COVID deaths if they're related. Like if you have COVID symptoms and the person died with COVID, but not necessarily from COVID. So there's already been problems with that prior. But now they have this new case definition, confirmed case definition. No change in the case definition. You need a positive PCR lab result. So again, the first person needs to have a positive PCR lab result test. Then from there, you see there's a new probable case definition. So one is confirmed case from the positive PCR lab result. A probable case can be from an FDA-approved positive lab with or without symptoms. So somebody goes and gets tested, they have no symptoms at all, and an FDA-approved positive lab says they've got it. Or they were in close contact with confirmed or probable cases. So again, it's assumed they probably have a case. New case definition for deaths related to COVID-19. COVID-19 is listed on the death certificate as a cause of death, and a PCR positive lab result for COVID-19 is no longer required. Do you guys get that? So even the problematic PCR test is no longer required to list COVID-19 as a cause of death. And then here was the little diagram she was showing. New probable case definition. A probable case of COVID-19. FDA approved testing and clinical criteria, or EPI-link. Clinical criteria. So this is how you get a probable case. FDA approved positive lab test. So you get a test that's been approved by the FDA, not necessarily a PCR test. And clinical criteria, which goes into here, or EPI-link criteria. So let's look at the two differences. So first off, let's say you suspect that you might have something. You've got a cold, or maybe you have no symptoms at all, but one of your friends tells you that they've got COVID-19 because they went and got a test and they trust the test. And so you decide, I'm going to go get a test done at some FDA-approved lab, and it comes back positive. So then you go here, clinical criteria. At least two of the following symptoms. Do you have fever? Do you have chills, rigors, myalgia, headache, sore throat, taste disorders, which are some symptoms of COVID, but also could be symptoms of different things. Like we had a giant dust cloud roll through Texas recently, they said from Africa. I know that had me sneezing and coughing. At least one of the following symptoms: cough, shortness of breath, or severe respiratory illness with pneumonia, acute respiratory distress symptom. Down here, EPI-link, close contact with a confirmed or probable case, close contact with a person with clinically compatible illness and linkage to a confirmed case. So a compatible illness, whatever the heck that means, and a linkage to a confirmed case. So somebody who's been linked, or travel to a residence in an area with sustained ongoing community transmission. COVID-19 is endemic to Texas. So if you've got a positive test and you've been near somebody who's also a probable case, but not a definite case, or you've got a positive test, but then you've also been to a place like Texas, then you can be positive. And this means a case is classified as probable, but not confirmed, if an individual can fit into the yellow box and the blue box without the green box, or the yellow box and the green box without the blue box, or a blue box and a green box without the yellow box, which means contacts has to be within 14 days of symptom onset. So if you've got some symptoms and you've been in close contact with the person, then you're a probable case. And I get it. Like some of you would say, like they're trying to track down the cases. They have to, come up with some sort of definitions. They're not going to be hard and fast. They might be incorrect sometimes. We could give them the benefit of the doubt, right? But this is not an isolated incident to Colin County, Texas. This is the entire state of Texas. And also we've had for months where the CDC said that cases that were, assumed to be with COVID or, had COVID, but other symptoms, even if they didn't die directly from COVID, it was to be listed on the death certificate. And then here's more probable case definition. So I'll take you back here to the original definition is you've got a confirmed positive lab result. And if somebody from your household has no symptoms, a friend reports symptoms within 14 days, that's not a case. Neighbor reports symptoms within 14 days, not necessarily a case. Coworker reports symptoms within 14 days, not a case. So all of these people, only one person would be counted. But then under the new results, the new way of measuring, they're saying like, look, you could come up to one confirmed case and 16 probable cases based on using all of their criteria now. It could be the friend, the household, the coworker's family, the neighbor's family, the neighbor's coworkers. And this allows them to amplify the count, the case count, not the death count, the case count. Contacts of a confirmed or probable case can be counted as probable case if they develop symptoms or if any other lab, not PCR, is positive for COVID-19. Positive PCR COVID-19 result is no longer needed if death certificate lists COVID-19. It will count as COVID-19 related death. And they go here to the new case definition for deaths related to COVID-19. So the immediate cause, leukemia. Maybe you say, well, the second cause was cardiac arrest and possible COVID-19. The current case definition, the example death certificate above is not sufficient. It has to be accompanied with a positive PCR result to be counted as COVID-19. Under this new definition, which went into effect in May in Texas, the example above, somebody with leukemia and cardiac arrest with possible COVID-19 would be listed as a COVID-19 death. Why is this so hard to understand? The number of COVID-19 related deaths is going to increase because of this new case definition. The Commissioner's Court was warning this back in May 18th. This definition went into effect May 11th. This Commissioner's Court hearing was on May 18th. And this presentation was put forward there. And I'm thankful that they did this, but I want to remind you guys, and at the same time, we're being told that the Houston ICUs are surging, which could be true. Maybe there are a lot of people who are getting sick for one reason or another. What they won't tell you is that a lot of the ICU beds are filled with people who don't have COVID, but people who are just being there treated for other things. And then we've also got them already testing vaccines here in Houston. And let me see if I can find you the other one. I don't have it in front of me. Well, the other one is about them talking about putting people, that you need to, that even in your own home, you might need to wear a mask. Right here, there you go. Texas, you should consider wearing a mask even when you're in your own home. So they're testing vaccines already in Texas. They're talking about making people wear masks in their own home. They're saying that the ICU is surging and we're the new epicenter here, and they're going to bring trucks with dead bodies in it. And at the same time, we have government officials here in Colin County, Texas, basically saying that, this is that they warned back in May, 2 months ago now, almost 2 months ago, that this was going to happen, that there was going to be an increase in the death count and an increase in cases because of this new probable case definition. So I will include all the links to everything we just went over in the description below the video you are watching. I encourage you to do the research on your own, come up with your own conclusions, share this video with your family and friends. I have friends who are nurses in Houston hospitals, and I'm going to send this to them and ask them what they think about it. Please, I'm not claiming that I know exactly what's going on. I've realized this the last 5 or 6 months. None of us have a tight grip on what exactly is happening, but we are definitely being propagandized. We're definitely being conditioned to accept things without hard evidence. So please, question everything, share this wherever you can, and until next time, remember, you are powerful, you are beautiful, and you are free. Peace.